Hi, it's Tom here. I wanted to talk to you today about a great discussion point that we've had in running repairs online, which is, should we use orthoses for plantar heel pain? And if so, how do we make that decision? So we're going to talk about some of the research in this video and some of the things that might influence my decision. I'd also like to say right from the start that I'm not an expert in orthoses, and I would tend to try and team up with a podiatrist. We work with some brilliant podiatrists that we can refer to. So if I do think they're going to help, I'd rather get that expert input from a podiatrist to see if we can really get the best results for patients. I'd really love to hear what you think on this, particularly podiatrists if you're listening in. How do you decide whether you think orthoses are going to be useful for a patient with plantar heel pain? What are the factors that will shape your decision? So please let us know in the comments and replies. I've also linked to a fantastic short article by Ian Griffiths and Simon Spooner on the biopsychosocial factors that may influence prescription of orthoses. So I really would check that out. And we've got our free webinar series that you can look into via the link I've shared there. A number of different free webinars that you can look at if you want to find out more about running injury. So let's start then by talking about a couple of recent systematic reviews on the effectiveness of orthoses in plantar heel pain. So first up, we have Rasenberg et al. Systematic review in 2018. Now this one rocked the boat a little bit because they found no difference in the improvement in pain or function between prefabricated, custom-made and sham orthoses for people with plantar heel pain. And this then sort of really questioned the value of orthoses in this group. Also, we have another systematic review from Whitaker et al. 2017. They both come out at a similar time. Slightly different results. They did find some moderate quality evidence that orthoses can reduce pain, but it was uncertain whether this was a clinically important change. So it does seem that the evidence isn't particularly clear. But of course, there are some limitations with the evidence. And speaking to podiatrist friends, sometimes they'll say the studies don't actually seem to prescribe orthoses in a similar way to how they may do clinically. So there can be some important limitations there. And what I wouldn't do is throw orthoses out altogether, but just be aware of the research that's out there. So how would we work with someone with plantar heel pain then and decide if we're going to provide orthoses and whether they're likely to be helpful? Well, it does need to be a reasoning process, and it does need to be based on each individual case. And we might start with some simple interventions like a gel heel cup, which has been used alongside progressive loading. So that might be a simple starting point. And activity modification, education, perhaps a progressive loading program like we see in the literature. But if this isn't working, or people have problems with pain and we think an orthosis might help, that might move us down that route. So some of the reasoning that we might have here, the first thought might be, can an orthosis for this person reduce provocative load on the plantar fascia? And we do think it's probably more about how we change the load on the tissues rather than saying that we're going to try and correct foot posture or alignment. And actually there's a lot of studies that show, some great bone pin studies that show that the movement at the foot and the ankle is very variable between individuals. So we don't really have a good handle on what normal is, or a real reason to try and push everyone towards this kind of mythical idea of a normal. There's also some mixed results in the literature over whether orthoses actually do change the kinematics, the movement patterns around the foot and the ankle. It's a little bit more consistent to show it changes the kinetics, so the forces that the foot and ankle are exposed to. So that would be my reasoning process. Can we find a way of reducing some of the provocative load on the plantar fascia, and therefore hopefully by reducing the load on sensitive tissue, reduce pain? Now we would work through that with someone then, and actually the next step would be to trial them. And this is something often we'll do in clinic, is trial some orthoses during a painful task that the patient has identified for us. So if it's walking, simple one, can we try a pair of orthoses and see, does it actually reduce their pain during walking within that session? And if it does, if it's a notable reduction in pain, that again would push me towards considering this more as an option, and then getting the podiatrist involved to see, do we need a custom-made pair of orthoses for this person? May a prefabricated option actually be quite reasonable for them, and actually lean on their expertise a little bit more. Now, there's also other aspects of this, because as the article I've linked to on biopsychosocial factors really points out, a lot of the prescription of orthoses is based around the biomechanical changes that they might make, changes in the forces that the tissues are exposed to, or potential changes in movement patterns. But we know pain isn't just about biomechanics. There's a much bigger picture involved with pain, particularly in plantar heel pain, where there's actually good evidence to show that psychosocial factors, things like anxiety, catastrophizing, are really important and actually can influence outcomes. So we want to factor that in as well to our decision-making process, in that the patient's beliefs and expectations really matter, particularly if they have a strong belief that orthoses are likely to help them, because that's probably more likely then they're going to get benefit from them. So if they're coming to you saying, I really would like to try some orthoses, I think they're really likely to help me, that would make me think it's probably a sensible thing to at least explore. On the flip side, and we have had this with patients, if they're saying, well, I really don't like the idea of putting something in my shoe, or I've tried that in the past, it's made my symptoms a lot worse, that might move me away from them. Now, also a really interesting thing about beliefs and expectations, as pointed out in that article I've linked to, is that we can shape them. So how we communicate about our treatment selection will probably influence the results we get. So if we're very negative from the outset about orthoses, and we talk about lots of negatives, it may well shape the outcome we get. If we focus more on the positive attributes, that may possibly lead to a more positive outcome. So bear in mind those beliefs and expectations and how we can shape them. It's also worth thinking here with the individual about the bigger picture in terms of their management. Simply handing someone a pair of orthoses and pushing them out the door isn't really going to cut the mustard here. And there is evidence of plantar heel pain that there's a lot of confusion from patients in terms of how they should manage it. There are a lot of unmet needs, particularly around activity levels, whether they should continue being active, whether pain is a sign of damage, how they can alter their activity levels. So I think by all means we might use orthoses if we think they're likely to improve pain and function, and we've got a good reasoning process for that individual, but we've got to make sure we use them in conjunction with the appropriate management. So help the person understand their plantar heel pain, explore some of those beliefs and psychosocial factors, guide them in terms of activity and how they can modify their activity to reduce pain, and then gradually build it up towards their goal activity. Consider the right rehab to improve their capacity to manage load, particularly important in our runners. If they want to get back to running and running distances, they need to have the strength and capacity to manage that. So we'd want to make sure that's in there alongside things. So I do think orthoses can be an option here, but we've got to use them within a comprehensive management program. We've got to think about the patient's beliefs and expectations, and we're probably thinking more about how they may alter load and less about how they may alter movement patterns. So I'd love to hear from you. What do you think? Are you maybe a physio or another clinician that actually uses orthoses a lot? Do you get good results? What influences your decision process? I'd really like to hear from you. Podiatrist, I'd really especially love to hear from you on this. I recognize you're the experts in this field. So what have I missed? What would really shape your decision-making process? How might you reason through how using orthoses could alter loading on sensitive tissue? I'd really love to hear from you in the comments and replies. Let us know what you think, and hopefully we'll get some great ideas and suggestions. I look forward to reading those shortly. Okay, thanks very much everyone for listening. As I said, we've got a link in the title there for that great article on the biopsychosocial factors in orthoses, but also to our running resource page, which has a great selection of free webinars. Okay, take care. Bye for now.